Hello everyone, it's Victor here, and today I am wearing my pie shirt. This is a really cool shirt. Look, you can see like the pie is actually made up of all the little numbers. So you have 3.1415926535897 and all the way down. So many digits of pi, isn't it wonderful? I love this shirt. Why am I wearing my pie shirt, you might ask? Well, it's a very loose connection, but we're talking about numbers today, and I love numbers. Today, I would like to talk about how much top surgery costs, both with and without insurance. I'll talk about the medical expenses, including like therapy and prescriptions and all of that kind of stuff, as well as like travel-related expenses. And also, I'll kind of talk through some of the expenses that I had related to top surgery that weren't directly medical or travel-related expenses. Specifically, there were a few odds and ends kinds of items that I didn't already have. Before going any farther, I just want to acknowledge that I am in a very privileged circumstance where I have access to the medical care that I need, and I also have a steady job that pays me a salary, where I also have health insurance that happens to cover some of these like transition expenses. And so I, on the whole, am extraordinarily fortunate, very, very lucky, and extremely privileged, and I just want to acknowledge that before going on and kind of breaking down the cost. So when I was originally researching how much top surgery costs, a lot of the estimates that I found said that you should plan to spend somewhere between $8,000 and $12,000, maybe 15 or 20 on the really high end of things if you don't have insurance, and that you should plan to spend about that much to get your surgery and to have all of the medications and all of the appointments and that sort of thing. Since I have insurance that covers a lot of the transition-related expenses, my actual costs were much, much lower than that. But when I go back and look through my medical bills, the amount that I would have had to pay if I did not have insurance is astronomically higher. Here, I'm going to break down in chronological order the medical expenses that I had, as well as how much those expenses would have been had I not been covered by insurance. In chronological order, the first expense I had here was a therapy session. Now, most insurances that cover top surgery require some kind of official letter from one or multiple therapists or like gender therapists or doctors or medical professionals stating that you are a person that experiences gender dysphoria to the extent that surgery is necessary. I got really lucky, and the therapist that I found only required one therapy session in order for her to be comfortable writing this letter for me, but she was such an incredible therapist that I actually started weekly gender therapy sessions with her and have extended those into the present day, and so she is absolutely wonderful, and I cannot recommend a good therapist highly enough. Because my insurance covers mental health related issues as like preventative medicine, I actually paid $0 for my therapy sessions, but my therapist charges, I think, about $120 per hour-long session, which is pretty typical in my area. So I would have expected to pay at least $120 for therapy for that one session to get the letter. Next, my consultation and pre-op appointment collectively cost me around $330, although it would have been closer to $1,400 without insurance. Before surgery, I also had to buy my surgical recovery drugs, which ran me $11, but retail for $600, which is an incredible disparity. And I also had to get a COVID-19 test done because it is 2020 and that is the way the world rolls when you have to go into hospital settings. So the COVID test cost me over $100, which I think is extremely pricey and seems kind of like a money grab since like my workplace does them for free. I don't see why I had to pay $100 for that, but you know, they wouldn't take the one from my workplace, they had to do their own. Now for the actual surgical costs, they kind of break down into several different categories. There's pathology, which is when they basically send the breast tissue to get tested to make sure you don't have any kind of cancerous cells in that tissue. So that was billed separately from the anesthesia, which, you know, allowed me to go under and not be awake during my surgery. Would not have wanted to be awake during surgery. And then the hospital and surgeon also had their own separate bills that I had to pay. So collectively, with insurance, all of that cost me $3,000, just over $3,000. Without insurance, it would have run, I think, around $100,000. That's what they all billed. But I think there's something weird with like, you know, if you're not on insurance, then they'll bill you like slightly less, but because they know you're on insurance, they bill you more, something like that. I'm not really sure how that works. Basically, insurance seems like it really came in and saved my butt from having to pay $100K in medical bills, because that is utterly ridiculous. And then of course we can't neglect the cost of actually having insurance. So I do pay like health premiums, and I like, put money into my HSA and all of that good stuff. And so my health premiums, I think total across the whole entire year, ran me about $1,110. So that is, I think, like the cost associated with having the discounts involved with insurance covering a lot of my medical bills. In the end, my medical expenses came out to be around $4,600, including the cost of insurance. Without the cost of insurance, just looking at my medical expenses related to top surgery, it came out to about $3,500. Next, I want to talk about the travel expenses involved in traveling for my top surgery, since I did not do the top surgery thing locally. So first, the travel expenses involved in actually getting to my surgical location and back. I did drive, and so that ran me around like $90 total in gas. And so that was for all the way there, driving around in Richmond, and then all the way back. I also had to come back to work before they were able to do my last post-op appointment. And so because it was just one appointment and it was only one day, I did fly for that, just because I would have literally spent like 25 hours just driving for like a 1-hour appointment. And so I did fly for that, and that cost me $160. Total in travel expenses, it cost me around $250. I was very fortunate to have a friend who lives in Richmond who was able to put me up for the 4 weeks that I was there for top surgery. And so I actually paid $0 in any kind of rent, or, renting a hotel or an Airbnb or anything, but I did pay like $15 to help them out with their utility bill. In terms of food, I mostly just bought groceries to cook for myself, and I also bought groceries for the friend that I was staying with, kind of as a thank you, so that they didn't have to worry about like buying groceries for that month. And so total, I ended up spending more on groceries than I would have in the course of a given month, but it was around $200 or $300 that I spent on food for those 4 weeks, and that was for 2 people. Total, my logistical and travel related expenses came out to about $550, which in the grand scheme of things isn't really all that much money for like a month-long like recovery vacation. Now I would like to talk about the last category, which is things that I bought specifically for top surgery. In general, I'm a very, very frugal person, and so I don't generally go out of my way to buy things that I am either only going to use once, or know that I don't necessarily need, or know that I have a suitable substitute for. There are a lot of people out there that recommend buying like all this stuff to kind of help you recover, and for me, I either had a lot of those things already or didn't really feel like I needed to go out of my way to buy like a life-size body pillow to like help me sleep upright because I have normal pillows and that kind of thing. But there were a few items that I thought would really drastically improve my quality of life for at least those first couple weeks while I was recovering, like in proportion to how much they cost. The first of these items was one of those like travel neck pillows. I knew I was going to have to be sleeping upright for a little bit, and I'm not someone who ordinarily sleeps on my back. The next item was a set of metal straws. And they were $3. The third item that I bought that I did not already have that I thought I needed was baby wipes. They cost me like $1.50 because I got like the generic store brand, and I used like the first 20 wipes out of like a pack of 80. So I still have like most of the baby wipes. They were a lifesaver for feeling not disgusting for that first week. In retrospect, I probably would have tried to get a smaller package, but it is what it is. For $1.50, I'm glad that I was slightly less stinky than I could have been. Finally, the last set of items that I bought that was specific for top surgery that I did not already have was some medical supplies. My doctor had supplied a lot of the things that I needed, but I decided to go ahead and supplement. And so I bought like bacitracin and some gauze and some paper tape, just to kind of like be taping the nipples with the gauze and like putting bacitracin and Vaseline and everything all over my stuff. Total, those medical supplies cost me about $20, I think. I said the medical supplies was the last thing, but I actually forgot about scar care stuff, so I'll go ahead and talk about scar care stuff here too. I bought silicone lube as kind of like a topical thing, and that was like $13 for like a big bottle that I've like barely dented for the scars. And I also recently bought some scar tape. It's I think the Sika tape roll kind, and that was like $18. So again, not like more money than I would have liked to spend on these things, but in the like for long-term scar care, like $20 is not that much. So probably worth it. I guess we'll see. In the end, I spent about $80 on stuff that I did not already have that were related to top surgery recovery. In the end, I ended up spending somewhere around $4,200 for the top surgery experience in terms of like actually getting stuff off my chest, in terms of recovery, in terms of travel, in terms of, you know, little luxuries and comforts that I afforded myself in order to be able to recover well. So in the end, that is about half the amount that I was expecting to be spending with the $8,000 to $12,000 estimate that I was seeing online. But again, this was an incredibly fortunate situation that I found myself in, where I had insurance that was able to, you know, help out with all of the medical expenses, because that's the really expensive part. If I hadn't had medical insurance, it looks like, at least from the bills, that I would have been charged like over $100,000 for the actual medical expenses. In general in life, I am more of a minimalist and a financial minimalist, so I really am kind of a cheapskate and I don't like to spend money on a lot of stuff. And so I kind of, with the top surgery experience, I kind of was similar, where I was trying to be frugal, and I did shop around for different surgeons and like kind of read reviews on like, you know, how much they cost and like, you know, what kind of work they did. And I strategically chose the location that I traveled to, knowing that I had a friend there who was able to host me for that month, in order to not have to pay for like an Airbnb or a hotel for that recovery time. And so I did try to kind of, you know, play it smart with expenses. I also very intentionally waited until I had the job that I currently have that has good insurance, before I really started on this top surgery journey, because I think without insurance, it would have been a huge financial burden on me. And so I bought one binder, and I wore that one binder like almost every day for several years. And I just like, for me, it like dysphoria is bad. And I didn't love having to like deal with like chest dysphoria, but in the end, I knew that it would cause me much more anxiety and much more stress to be stressing about money. And so for me, that's kind of why I waited until when I did to pursue top surgery. But now I'm on the other side of top surgery, and it looks amazing, it feels amazing, and it's just the most incredible thing ever. And yeah, I don't know how I ever did this before without a flat chest. It's so incredible, and I like love it, and I can't stop touching and stop looking every single day. So every single cent of the $4,000 something that I spent was so worth it for me. Everyone's different. Top surgery may not be the thing for you, but for me, it was super worth it. All of that was kind of rambly. Basically, I'm a cheapskate. I tried to do top surgery as inexpensively as possible, and I'm glad that I waited because I didn't want to stress about money, and I'm very glad that I did it when I did because it feels amazing. That's the short version. Thank you all so much for watching this video. Please do consider liking and subscribing if you want more trans-related content or maybe more money-related content in the future. All the best until next time.